We're going to talk about this story of a virus that really just seemed to come out of absolutely nowhere and changed, well, everything. A disease that earned the terrifying title, the plague of the 21st century. But here's the thing. What if the story you think the one about where it all came from, how it all began, what if that's only part of the picture? Let's dig in and uncover the real history behind the AIDS epidemic. So picture this. It's the early 1980s. A really scary new illness starts popping up all over the United States, and honestly, doctors are just completely stumped. You have these healthy young men who are suddenly dying from these super rare diseases that, should really only be affecting someone who's very old or already very sick. Something is just shredding their immune systems, and nobody has a clue what it is. And then things started to become official. On June 5th, 1981, the CDC puts out its first report on a rare lung infection. And less than a month later, the New York Times is reporting on this bizarre cluster of cancer cases. These were the first real public alarm bells that a devastating new health crisis was unfolding. Now, at first, it looked like this disease was only hitting these really specific communities. This led to a whole lot of confusion and, just tragically, this deep, damaging social stigma. It was cruelly nicknamed the 4-H disease, a label that just fueled so much fear and prejudice, right at the moment when what was really needed was compassion and a clear public health response. So as the crisis is getting worse and worse, the urgency is just off the charts. Scientists all over the world jump into this race against time to figure out what is causing this mysterious collapse of the immune system. What was this invisible enemy behind it all? Finally, in 1983, researchers nail the culprit, the human immunodeficiency virus, or HIV, and they figure out it's a retrovirus. Now, this is a particularly nasty type of virus because it goes after the body's CD4 cells. Think of these cells as the generals of your immune system's army. HIV takes out the leadership. So, how does a retrovirus even work? Well, it's pretty clever and terrifying. It doesn't just infect a cell, it completely hijacks it. It literally writes its own genetic code right into your DNA. It turns your own cells into permanent virus-making factories. And that is why it's been so incredibly hard to find a cure. Okay, this is a really important point. The difference between HIV and AIDS. HIV is the virus itself. AIDS, on the other hand, is the late-stage condition that can happen if HIV goes untreated. You're diagnosed with AIDS when your immune system gets so weak, so beaten down, that you become vulnerable to all sorts of life-threatening infections. All right, now let's get into a really fascinating part of this story. See, every big story needs a beginning, right? And back in the chaos of the 80s, the public, the media, they were desperate for a simple explanation. They wanted a single person to blame for the whole thing. And this search, well, it created the myth of patient zero. This quote right here is attributed to Gaëtan Dugas, a charismatic flight attendant from Canada. He became the face of the epidemic spread, really a symbol of what was seen as reckless behavior in the face of a deadly new disease. So, in a 1984 CDC study, Dugas was labeled patient O, the letter O, for out of California. But somewhere along the line, someone misunderstood, and the letter O turned into the number 0. And just like that, the name Patient Zero was born. He was publicly dragged through the mud, branded as the man who brought AIDS to America. I mean, it's a compelling story for sure, but was it true? Could one man really have single-handedly started an epidemic across an entire continent? Well, science would eventually give us a very, very different answer. So thanks to some incredible genetic and archival research, scientists have actually been able to trace the virus's true journey. And it turns out the story of HIV started long, long before anyone had ever heard of Gaëtan Dugas. And the evidence is it's undeniable. We now know that back in 1959, a man in Congo died from an illness that was later confirmed to be HIV. 10 years later, in 1969, a teenager in St. Louis died from the very same virus. We're talking decades before the first official reports in 1981. HIV was already silently making its way around the globe. Gaëtan Dugas wasn't patient zero. He was just one more tragic victim in a very long, invisible chain. And this really shows the stark contrast between the myth and the science, right? The popular story was simple, it was easy to digest, and it gave everyone a scapegoat. The scientific reality, what's known as the cut hunter theory, is, well, it's a lot more complex. It suggests the virus actually got its start in Central Africa, way back in the early 20th century, probably when a hunter was exposed to infected chimpanzee blood. So this is the journey that science has pieced together. It starts in the 1920s, when the virus jumps from chimpanzees to humans. For decades, it spreads pretty slowly, helped along by the growth of cities and colonial trade routes. Then, in the 1960s, it travels to the Caribbean. And from there, it finally enters the United States sometime in the 1970s, years before those first cases were ever identified in Los Angeles. Okay, so that brings us to today. The story of AIDS is no longer just about mystery and fear. Now it's also a story of incredible scientific breakthroughs, but also some really big ongoing challenges. First, we just have to acknowledge the absolutely devastating human cost. An estimated 33 million people. Let that sink in. 33 million people have died from AIDS-related illnesses since this whole thing began. It's just a staggering loss that has touched every single corner of the globe. But, and this is a huge but, here's where the story takes a really remarkable turn. The development of antiretroviral therapy, or ART, back in the mid-90s. It was nothing short of a medical miracle. These powerful drugs, they stop the virus from copying itself, and that lets the immune system recover. For people who can get the treatment, HIV was transformed from a certain death sentence into a manageable chronic condition. And the epidemic itself keeps evolving. All around the world, things are changing. Take Iran, for example. The main way the virus was transmitted used to be through intravenous drug use. Now, it's primarily spread through sexual contact. This just shows how prevention efforts have to keep adapting to what's actually happening on the ground. This data also shows another really crucial part of the modern epidemic. While men still make up the majority of cases in a lot of places, women are also significantly affected. It really highlights the changing face of this disease and how different groups of people can be vulnerable. And that brings us to the final and maybe the most important point. We have the medical tools to control HIV. The drugs work. We know they work. But the single greatest barrier to ending this epidemic, it isn't the virus anymore. It's us. It's the social stigma, the fear, and the prejudice that still surround this disease. And that's really the question we're left with, isn't it? How can we, as a society, fight a virus when fear and judgment stop people from getting the help they need? Stigma is what prevents people from getting tested, from seeking treatment, from having open conversations with their partners. It drives the whole epidemic underground, which just lets the virus keep spreading. So, when we look back at this whole history, the question isn't just about medicine anymore. It's about our own capacity for compassion, for understanding,